When not being worn, all glasses should be placed in appropriately labeled cases and stored in the client's bedside table. So, kanang itong mga drawers sa gilid sa bed sa client. So next is we have care of contact lens. So we also have patients who are using contact lenses. So patient teaching for contact lenses. So we must explain to our clients that all lenses must be removed periodically to prevent ocular infection and corneal ulcers or abrasions from infectious agents. So we must also inform the client of the following indicate lens overwear. So if sobrang tagal sa contact lens, if inside, may I know if inside the contact lens here? So overwearing of contact lenses may lead to pain, hearing, discomfort, redness, and conjunctiva. So even like applying pa nanakay na pain. So next is instruct the patients on the following. So do not use fingernail on lens to remove dirt or debris. Then if karon galit na like katong meaning washers, contact lenses. So, pwede yapon to siya gamiton. So, do not use strong water to clean soft lenses. So, follow recommendations of lens manufacturer or eye care practitioner when inserting, cleaning, and disinfection lenses. So, keep lenses moist or wet do not worn. So, sa kanang mga solutions, we have different kinds of solutions like unsa ang solution, cleaning solution lang sa contact lenses. Solution nga ginagamit if kanang mag-drops ka sa eye, if irritated na ang mata. So, next is use fresh solution daily when storing and disinfecting lenses. Wash and rinse lens storage case on a daily basis. So, even though ginagipyuan mo permi or wash niyo yung mga contact lenses, per yung case, dili mo ginapugasan on a daily basis, kay useless sa gyapon mo pag-clean sa mga contact lenses. So, if lenses is dropped, moisten finger with cleaning solution and gently touch it to pick up. Then clean, rinse, and disinfect. So, each lens container has a slot or cup with label indicated whether it is for right or left lenses. So, always start with the same lens when removing or inserting lenses to avoid mixed up. So, may I know sa kung gagamit of lenses, why is it necessary to remember if asa ang left or asa ang right?
Para dili ma-contaminate.
Aside pag-start pa lang ato nag-explain nga we must treat our eyes differently. So maybe irritated na pikas, then ang pikas wala pa din. If mo siyang i-cross, then cross contamination will happen. So next is, it is essential the correct lens may be stored in the appropriate slot so that it will be placed in the correct eye. So especially katong lenses nga na ay katong grades, so important yan kung siya para dili mag-relevant. So throw away disposable or replacement lenses after prescribed wearing period. So katong lenses period, how long din siya usually ginastore? I think that's the maximum of 8 hours that you need to remove it. So we have to remember the acronym RSVP: redness, sensitivity, vision problems, and pain. So even challenging for someone of 8 hours, if you're wearing contact lenses and you're experiencing the RSVP, then it is best to remove the contact lenses and do the proper cleaning, disinfection, and storage. Next is we have the general eye care. So this will be the last part of the eye care. So avoid home remedies for eye problems. Next, if dust or dust gets into the eyes, clean them completely with clean dirty water as an emergency treatment. So dili man nato we can't avoid na there sometimes na malagsikan na itong mata o any foreign object. So we can perform this as a way of first aid or emergency treatment for that. Next is take measures to guard against eye strain and protect vision. So nowadays it is very popular na to the development of anti-radiation glasses na it is recommended for those who are always always using gadgets to use the anti-radiation glasses in order to protect your eyes from strains and also protect your vision. Next is schedule regular eye examinations, particularly after age 40, to detect eye problems such as cataracts and like glaucoma. So usually, common po na eye problems na ay mga diabetes. So, yeah, common na silang magka-eye problem. So next is for the...
How would you differentiate that it is not eyes, glaucoma,
Ang pupil.
So,
Pupil.
if based
Pupil
on
of reflection sa light,
based
hindi
kung sa
mag-dilate.
akong nabasa kay, ang vision mismo sa kanang na ay na having this kind of condition kay lagi siya, ang glaucoma is ang center ba? Wala, dili makamura. Dili maklaro ang center.
Oh, pupil.
Then, ang cataract ay maraka sa whole faded ilang vision, medyo white ilang vision. So, next is we have for the nose care. So, nose care assessment. So, why is it, any one of you who knows why is it important to do nose care assessment and generally doing nose care?
Para limpyo yung nose.
Okay, Miss
Pero usually ka nang ginagita na na air, so for mga dust bitaw, dapat i-clear mo siya para apoy ko naman.
Okay, so why we are doing nose care assessment? So to check the position and general appearance of the nose, the patency of the nostrils, presence of tenderness, dryness, edema, bleeding, or discharges. So care of the nose. So having the patient blow the secretions from the nose into a disposable tissue, and bleeding is a sign of harsh blowing. So usually, if I know some of you, if stubborn tungkol sa sipon is, you tend to blow harder para lang to feel the ease nga para mahurot na yung sipon. But actually, dili yun na siya recommended nga buhaton since it may cause ka na mas ma-irritate na noon ang inyong kuwanden. If makabantay mo, murang bumol mo, kaya masobran yung blow in yung nose. So, next. So, if the patient is not able to remove nasal secretions, wear clean gloves and help the patient using moistened washcloth or cotton tip applicator with a water or saline solution. So, I think dili na lang po siya kailangan i-perform. Still, white lang yapon siya. And I think, kuwan yapon ka na, magamit yapon na ito ang correct miter sa white. So,
sigurado ka?
if, then if, katong Q-tips. Q-tips ang gamitin. So, use water or the saline solution para ma-loosen mga same so, next is do not insert the applicator beyond the length of the cotton tip. So, there's a things usually gagamit of Q-tips or cotton swabs to clean their nose. Or mas reliable ang kamot. So, ang first dapat is magamit na ako para Q-tip pero parang na-satisfying gamitin ang kamot. So, next, care of the nose in patients with NGT. So, when patient has nasogastric or feeding tube, change the tape anchoring the tube at least once a day. So, not only nose mismo ang permeability, but also ang those mga materials na naka-attach ani also to prevent infection. So next is when patients receive oxygen per nasal cannula, you should rinse the nails every 8 hours. Use a cotton tip applicator moistened with saline. So, katong nasal cannula, katong anak na mga oxygen. So, every 8 hours, it is important to clean that. They usually, if naay mga discharges or naay mga cartilage debris, so ma-remove siya with the help of swab and moist and saline. Next is gentle suctioning may be necessary if the secretions are excessive. So, if you've noticed niya, usually mas common siya ginagamit sa bata ang kaning suction since dili pa kanila siguro makontrol ang one, so dili pa makabalo to blow. So it is important to aid them para po niya mais ang ilang feeling ng murag clog ang ilang nose.
So I will be explaining the ear care and the mouth care. So the fore care is very important to prevent infection and then hearing loss, blindness, and so important siya na ito ang to know. So ear care. So basic ear care involves cleaning the ear with the end of a moist washcloth related gently into the ear canal. It involves paying particular attention and the development of wax in the ear canal, foreign body dryness, crusting, and presence of any distress, as well as the general appearance. So if mag-clean na og ear kay i-moist din mo niya siya and then kanira ang tip then rotate.
Okay.
Moist din mo nila yan. Sunod niya ko sa pagsubat sa ear canal. So basically this is ang anatomy of ear and then ang surrounding is ang earwax. So one ang earwax. So basic ear care kay ang equipment, washcloth, warm water, wash basin, clean gloves, sterile saline, solution, clean towel, and water faucet. So kailangan kasi naman ang kasi wala na. So care for the ears, cleanse the tina with soft towel or moist washcloth. Do not force towel into the ear for drying to prevent formation of wax clots. Loosen and remove visible cerament by retracting the auricle downward and back. So wala kong gilingan na i-moist ninyo ang inyong towel. Ang tina is ang outer ear. So, dili niyo. Ang kanang mga, dili the soap. Push too hard. Yes, ma'am. Rotation, ma'am. And then,
So, anak,
ang tip na dayan para
sulod din siya.
yes. Yes. So, model of caution when cleaning our ears. So, do not use bobby pins, toothpicks, or cotton tip applicators to remove cerament. This can rupture the tympanic membrane or traumatize the ear canal. And also take note, even a cotton tip applicator can push wax into the ear canal, which can cause blockage. Kana ang mga Q-tips kay ganang if mo na ang atong i-use kay mo ma-push ang atong cerament inside then ma-block na dahil ang ato ang eardrum. So advisable na atong i-use to clean is kanira yung tip sa atong washcloth na wet sila. So if the cerament is not loosened per doctor's order, so need niyo ang doctor's order ang cerament na lain tape. So ang kanan siya is kanang mura siya if sa eyes mura siya eye drop, pero diri is kanang drop siya nga i-drop nimo sa inyong ears to soften ang iyang earwax if wala nang tangtang sa kanin. So need na siya ang doctor's order. So next tayo na tutuhatan if wax softener is ineffective, irrigation may be necessary per doctor's order na sad. So if wala din na soften siya sa drug na imong gibutang, so mag-need na sa air irrigation. So air irrigation is an air cleansing method used to remove a build-up of earwax. Irrigation involves inserting liquid into the ears to flush the earwax out. The tap water used for this procedure should be at body temperature to aid patient comfort and reduce risk of problems such as dizziness or trauma. So, ang air irrigation is katulad ng nanay MSN basin kay katulad ng B-size na basin na kalito.
Basin. Basin.
Okay, so, katulad, pa-curve siya, then yung cellphone ang kuan din. Then, magawa siya earwax. Lagi sa TikTok ang natin. So, hearing aid. So, battery-powered sound amplifying device used by people with hearing impairment. So, naay two types of hearing aids. Ang nasa behind the ear, muna behind the ear, and then in the ear, and in the ear. So, hearing loss is a common health problem with the elderly. The aid assists in the ability to communicate and react appropriately in the environment. Clients with hearing aids are at greater risk for surrounding infection. So, since naman sila hearing aids, so kanilang mga ilahang earwax can build up because so na sila high risk. So, if naaga ni hearing aid atong patient, so muna itong buhaton, when not in use, the hearing aid should be stored properly. Then, the hearing aid should be turned off when not in use. The outlet of the hearing aid should be cleaned with a clean, dry cloth to refer to manufacturer's instruction. So, naman na instruction ang box nito. Ipalit mo. Pwede ka ma-refer dito yung mag-clean ka sa hearing aid. Then, aid should not be submerged in water so hindi naman siya isink sa water. Or hindi siya mabuba. And then next, remove and disinfect battery if not in use. Replace air molds every 2 to 3 years. Avoid using hairspray and perfume when wearing the aid because residue from the spray causes hearing aid to become greasy and oily. So, if the patient loses a hearing aid, the batteries must be checked routinely and the earpieces or ear mold cleaned daily with mild soap and water. So, if naatay patient na naay hearing aid, so atong role is to check routinely blood if okay pa ba yung battery and clean to the mga yung ear molds with mild soap and water. So, mouth care. So, regular oral hygiene includes brushing, flossing, and rinsing. This prevents and controls plaque-associated oral diseases. So, poor oral hygiene is related to risk of impaired nutrition, poor blood sugar control and diabetes, nursing home acquired pneumonia, diminished salivary production, and risk for infection. So, the purpose of brushing and flossing the teeth is to remove food particles from around and between the teeth, to remove dental plaque, to promote the client's feeling of well-being, to prevent sores and infection of the oral tissues. So, understandable naman siya, di ba? Why ita nga mag-brush or mag-floss? So, one of equipments needed if mag-perform na ka. So, towel, clean gloves, basin, toothbrush, dental floss, normal saline, cough depressor, and pen light. So, steps. Patient. Great. See a patient. So, first step you need to do is prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how he or she can participate. So, if by doing that, maka-establish the cooperation towards your patient. And then perform hand hygiene prevention procedures. So before, we all know that before you ka mo touch atong patient, mag-practice yun sa atong hand washing. And then provide for client privacy by drawing the curtains around the bed or closing the door to the room. Prepare the client, assist the client to a sitting or side-lying position. So sitting position is mayus siya. Pwede sa siya, if imuhang patient is kana kaya na niya, pwede rin mo siya i-ask if o sa yung mas prefer, if mag-sideline ba siya, or katong lateral position na to, or sitting position. So, sitting. And then next, prepare the equipment. So place the towel under the client's chin, apply clean gloves. So, if nag-sit siya, kanang i-place mo ang towel dito sa ubos, and then mag-apply kang clean gloves. Then next, moisten the bristle of the toothbrush with liquid water and apply the dentifrice or toothpaste to the toothbrush. So, if mo ang toothbrush, soft na bristle, itong makasama dito, soft siya din. I-wet mo siya sa water and then put a toothpaste. And then for the client who must remain in bed, place or place a curved basin under the client's chin. So since ang atong patient, pipili siya kung mag-sit siya, atong gamitin is katarang towel. If ang patient nagkatarang position, saan mo siya sa basin?
Kaya pa ba na yung patient ba?
Then, mauna niya ang time na mag-use ka sa pen light.
Sige na yung sugi, kaya
Gahapon.
o wala nang dapat pagbilan ng mga materials.
So, next, mag-inspect ka kasi yung house. So, katong pen light, natin sa
Yun ay kanilay.
Ato, pero sa mata, di ba katong gahapon at kumakuha ni Sir Ray. So, wala mo yan na. Since katong tank depressor na yun. Ang tank depressor, kaya meron sa ice cream ng popsicle, bitaw. Ulit na. Para ni-inspect mo.
Ah.
Para makita rin mo kung hindi mo i-inspect. So next, brush the teeth. Add the toothbrush to the client or brush the client's teeth as follow. So mag-ask ka sa imong patient, unconscious na imong patient na. So unconscious sa imong patient. So conscious sa imong patient. So mag-ask, di ba, nakananin yun siya toothpaste. Mag-ask ka sa patient kung asa siya mas comfortable. If siya mo toothbrush, ikaw mo toothbrush. So next, hold the brush against the teeth. Fill the bristles at a 45-degree angle. The tips of the outer bristles should rest against and penetrate under the gingival sulcus. So 45, so one yang straight, so 45 degrees. Measure.
You have to bring next week soft bristle toothbrush, ha? Bring your own soft bristle toothbrush next week.
So assuming na kaniyang bristles, then paano
Bring
siya?
your own toothpaste.
Paano siya? So, ano, 45 degrees paano rin. So, don't worry kayo. Next slide natin kayo. Makasabot na mo. So, next, repeat until all the outer and inner surface of the teeth and sulcus of the gums have been cleaned. Clean the biting surfaces by moving the brush back and forth over them in short strokes. Brush them down gently with the toothbrush. So, manang ginon. I-hold mo ang toothbrush for 45 degrees, then up and down. And then next is sa crown. Ang crown is then i-reach the pizza gum, and then pa-anik. And then next is clean biting surfaces by brushing back and forth. So, kanin, nasa middle. And the next clean lateral surfaces by moving the touch. So, another example. So, 45 degrees, crown, biting. So, seventh is have the client in a water cup to release the mouth rigorously. Then ask the client to spit the water into the basin. Some agencies supply a standard mouthwash. Alternatively, a mouth rinse of normal saline can be an effective cleaner and moisturizer. And then repeat the preceding steps until the mouth is free of deadly flies or food particles. Remove the curved basin and have the client wipe the mouth.
Bring your own glass, right? Next week, we have to do that mystery stuff.
And then let's move on to flossing the teeth. So flossing the teeth removes plaque and tartar between teeth and tooth surface. So nine thread. Kabalo ka na yung floss mo. Commercial thread. Dayon, ang kan. Ang end sa imong floss, kaya imong i-wrap siya sa imong kanya kamot.
Tama na.
Middle.
Healthy.
Third. And then, so according to American Dental Association 2014, flossing once a day is sufficient. So, assist the client to floss independently or floss the teeth of an outer and cooperative client as follows. So, make use of a seesaw motion and seesaw. And then wrap one end of the floss around the third finger of each hand. So, kani sa left and right din mo, i-wrap din mo sila ang both ends sa floss. And then, to floss the upper teeth, use your thumb and index finger to stretch the floss. So, na-wrap na din mo sila. And then, ang kani napili niya na floss, kani, yun mo siya niyan, ipikon. And then, gently move the floss up and down between the teeth. If upper teeth tap, up and down. So to floss the lower teeth, use your index finger to stretch the floss. Wrap one end of the floss around the third finger of each hand. So give the client liquid water or mouthwash to rinse the mouth and curved basin in which to stick the water or the mouthwash. So, assist the client in wiping the mouth. Remove and dispose of equipment appropriately. So, remove and clean the curved basin. Remove and discard the gloves. Perform hand washing. And document assessment of the teeth, tongue, gums, and oral use.